views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of Bronxnet or the program underwriters.
As usual, we'll start out with some introductions. My name is Marika Scott McFadden. I'm the Deputy Borough President here in the Boogie Down Bronx. And to my left,
Good morning, Councilman Rafael Salamanca, District 17.
Tom Lucania, Director of Community Boards for the Borough President.
Gilberto Alvarado, Community Liaison for Councilmember Diana Ayala.
Brian Melford, Budget Director for Councilmember Andy King.
Greg Faulkner, Councilman Cabrera's Chief of Staff.
Ron Jordan, First Deputy Chief of Staff for Councilmember Richie Torres.
Good morning, Shannon Knotts, Deputy Chief of Staff for Councilman Rafael Salamanca Jr.
Hi, Bill Hall, Chair of Board 12.
Good morning, Mohammed Majumdar, First Vice Chair, Board 9.
Rosemary Ginty, Chair, Community Board 8.
Jean Hill, Chair, Community Board 7.
Kathleen Saunders, Chair, Community Board 4.
Roberto Crespo, Chair, Community Board 2.
Martha Sabio, General Counsel for Bronx Borough President.
Marisol Halpin, Director of Borough Operations for the Bronx Borough President.
Good morning, Ralph Acevedo, Board 2.
Good morning, I'm Ken Brown, Chair, it's early. District Manager, Board 5.
Aisha Bravo, District Manager, Bronx Community Board 7.
Good morning, Kira Gannon, District Manager, Community Board 8.
Good morning, Shirley San Andres Alonso, Assistant District Manager, Community Board 9.
Morning, Jeremy Wernicke, District Manager, Community Board 11.
Good morning, George, Community Board 12.
Good morning, I'm Nora Moran, Policy Director at Safe Horizon.
Good morning, Maureen Curtis. I oversee their criminal justice programs at Safe Horizon.
Good morning, Doris Alcantara, DOT.
Good morning, Jose Davila, IGA with FEMA.
Good morning, Brian Pagnoli, New York City Emergency Management, IGA.
Effie Artisoni, DEP.
Good morning, Erica Prata Downey, New York City Department of Health.
thank you all again for being here this morning and welcome. We'll just jump right in. Pursuant to Chapter 4, Section 85 and Chapter 69, Section 2706 of the New York City Charter, a joint meeting of the Bronx Borough Service Cabinet and Bronx Borough Board will take place on Wednesday, October 25th at 9:15, right here in the Rotunda at 851 Grand Concourse. And we want to, again, extend a welcome to our first presenters from the Department of Health and Mental Health with their Heading Home Healthy program. And then we have Mr. Alan Dorsonville, right? Yes. Okay, thank you.
Good morning, everyone. Thank you for having us, and let me know if you need me to speak a little bit more clearly into the mic. I'm here with Dr. Lucretia Jones, and again, we are from the Bureau of Communicable Disease at the Department of Health, and today we want to talk about our community health education program called Heading Home Healthy. And I want to quickly acknowledge our partners at the Center for Disease Control and Prevention and at Massachusetts General Hospital, who helps fund this program through a small grant. And so during today's presentation, I would like to give you all a brief overview of what we mean by travel health and what the Department of Health and Mental Hygiene is doing to address travel health within New York City. And at the end of the presentation, we would like to ask if there are any ways that we could bring our program to the Bronx and reach out to more people through various events, organizations, programs, and whatnot. And so just to provide some brief context, again, we work in the Bureau of Communicable Disease. We are responsible for the investigation and prevention of outbreaks within New York City. And oftentimes during routine investigations, we find out that a lot of people become sick after traveling to other countries. And so a major thing that we try to do is we try to prevent preventable diseases when possible. And that is exactly what the goal of this program is. Our goal is to reach out to communities of people that travel back home to visit family and friends, also known as VFRs, and educate them about healthy travel. And the reason why we focus on this particular subgroup of people is for a couple reasons. One, people who tend to travel to visit family and friends back in their home countries tend to stay abroad for a longer period of time, from a couple of weeks to a couple months, whereas tourists are usually staying at another country for a couple days to a week. Another reason is because people who are visiting family and friends tend to stay in residential areas, whereas tourists tend to be in a little bit more touristy resort areas. And last but not least, we want to address the misconception that if you're born in the country, you're immune to the diseases that are present there. And the reality is, once someone comes to the U.S. for a certain amount of time, they lose all immunity they have to the diseases in their home countries. So they're just as likely to get sick as someone visiting the country for the first time. And so that's why we really try to focus on those communities for travel health education. And our goal is to make them aware of the endemic diseases that are present and provide the necessary information so that way they could stay healthy during their travels. And some of the most common diseases that we deal with are hepatitis A, malaria, dengue fever. And something else that I also want to note is that because New York City is home to many people who were born outside the United States, we have all of our information available in at least 10 different languages, so that way we can present this information to as many people as possible. And so just to give you an idea of some of the current outreach events that we've been doing at the Department of Health, we try to meet people at the places where we know that we can get their attention and where they'll be receptive to the information. So we've gone to doctors' offices and health clinics. We've also gone to a number of faith-based organizations. We've held presentations at community-based organizations and in community boards such as this one. We often table at health fairs, and we've gone to New York City public schools to try to talk to the parents of children as well. And we try to be really strategic in our outreach, and so we've done a lot of outreach specifically with the West African community, and we've done that through African hair braiding salons and also going to barbershops where there are a higher number of West African males. And so our message really has three key messages. The first one being that we want people to see their doctors 4 to 6 weeks before travel. Reason being is that there are often vaccines people can get to prevent themselves from getting sick once they travel to another country. And there are also medications that people can take to prevent travel-related illnesses such as malaria. The second thing we often tell people about is to be careful about food and water. We tell people to be careful about the food that they eat, make sure that it's thoroughly cooked, so that way they're less likely to get sick. We also tell people to make sure that the water they're drinking is filtered and safe to drink. Otherwise, we advise that they drink bottled water during their stay. And last but not least, we educate people on mosquito bite prevention. There are a number of diseases that are spread by mosquitoes and insects, such as, again, we've mentioned already malaria, chikungunya, West Nile, Zika, a couple of popular ones. And so we really stress the importance of using insect repellent and mosquito bed nets. when traveling. And all of our presentations are accompanied by a couple incentive items. So we have some coloring books for children. We have a couple bags. We usually give away mosquito repellent. We have luggage tags and passport holders and a number of other things as well. And the whole idea behind this is that we want to give people items that they'll use when they're traveling, so that way they'll remember the key messages that we gave them. And last, we always introduce people to our website, headinghomehealthy.org, which has a lot of resources for people. They can find fact sheets on there. They can find video explanations. They can even find a list of travel clinics within certain parts of New York City where they can go to get vaccinations if they don't have a regular doctor. And I just want to quickly demonstrate what we call our trip tool, which is something that people can easily use to inform themselves about which diseases to be aware of before traveling. So this is what our website looks like. And if you go to the For the Traveler button, again, you'll see a lot of resources that people can look at during their free time. But what we point people towards is the trip tool, the Traveler's Rapid Health Information Portal. And so it basically asks 3 questions. Ask if you're 18 or older. Reason being, children often require more vaccines than adults. It'll ask you for your zip code, and I'll just put in one for now. And then it asks you what's the country you'll be traveling to. And just for this presentation, because again, I've mentioned a lot of outreach with the West African community, I'll just put in Ghana for now, just to give you guys an example of the information that comes up. And so, as you can see, all of the information that we give people during our presentations is also available here in case they forget. So it'll tell them that they have to see their doctors 4 to 6 weeks before traveling, and it also gives a link to a directory of clinics that they can visit for vaccines. It also gives them a list of diseases to be aware of, listing hepatitis A, meningitis, rabies, typhoid, and yellow fever. It does let them know that malaria is present in their country, so they know to ask for prescription medication when they see their doctor, and it also provides some other recommendations. And then it breaks it up into advice for things for people to do before they travel, during the trip, and after the trip. And so we find this is a really useful resource for people that they can quickly check and access themselves as soon as they make plans to travel. I also want to mention that this information is backed by the CDC in real time, so all the information is always up to date. And so that concludes the information part of our presentation. Our ask of the members of this council is that if they have any contacts or leads for people, places, programs, or events where this information might be really useful to share with people, we would really like to work with anyone and everyone. And again, we've done a lot of outreach in the Bronx already, and what we're really hoping to do over the next couple months is expand that outreach to different communities within this borough. And so right here you'll find the email for our travel health specialist, Leanna Gray, and you'll also find my email below. Thank you. At this time, I'll take any questions and also any recommendations you may have.
Thank you for your presentation. I saw Ms. Hall's hand up first, so I'll come to you first. I just wanted to make, a comment, and maybe you can, you can speak to the point. I think some people feel that what's the worst thing that can happen? I'll get sick. Mm-hmm. Can you speak to the fact that some of the complications from these, such as malaria and others, can lead to death as well? So this is very serious, and can you both speak to that?
All right. You want me to take it or you want?
Yes.
most people don't understand that we have over 200 and maybe 25 cases of malaria each year in New York City, and predominantly those are people who travel back to visit friends and relatives. And it's preventable with prophylaxis, with medication taken. And people get very sick. The majority of patients are hospitalized. It's loss of income, loss of work, and they get very sick, especially children are at risk. And we found that parents are more likely to take their children for medications because they weren't born in that country. So they know, but they don't realize their risk. And many people believe malaria is a mild disease, and if they get sick, they'll just get treated until they get sick. We have done surveys to find that once people are sick with malaria, they then, the next time travel, will take precautions. So it's really important. And with this tool, travelers can go on themselves and see what they need to do. Also on that portal is a link for providers, for the clinicians to go on, and it helps providers who are not really savvy in travel medicine to know what medications and what to recommend. So that's why we're reaching out both to clinics and providers as well as the community.
Right. And I also want to say that our website at the Department of Health gives a lot of information on all of the different diseases that we cover, and so we often do also provide supplementally education and like pamphlets and whatnot that give a list of, that give more details as far as what are the symptoms of things. And we do stress the severity of it, and again, because some people sometimes think they're immune to diseases because they were born in the country, we do like to stress that, again, you are likely to get sick. You're just as likely to get sick as anyone else once you spend some time in the United States. And so, but that remains to be one of the challenges, kind of stressing the severity of these illnesses.
Okay, thank you. Ms. Hill?
One, I would like to invite you to where I live because we have a huge Ghanaian population, so I will get the information and maybe we can set up a presentation there. But also I'm curious, how easily transferable are any of these diseases back and forth to population when people come back from their home countries, because we all mix and mingle. So is any of this stuff like malaria easily transferable, or what's the scenario?
Well, well, with malaria, it's not. But with Hep A and typhoid fever, that is an issue, and a lot of times people will come back, and many people who travel to countries that are endemic with Hep A are food handlers and workers. So we've had outbreaks in the Bronx with Hep A, where we had to set up a big vaccination clinic because of someone working in a restaurant. So that is, it's through stool and feces and food and handling. So typhoid and Hep A, that is a concern. Not so much with malaria, but we get more, many cases of that as well.
Mr. Hall?
Yeah, I just wanted to ask, if your primary care physician is not too familiar with the tropical diseases, should the Department of Health be the primary agency that you contact if you're traveling abroad, or should that be your primary care physician, even if they're not too familiar with tropical?
Well, that's why we're reaching out to the medical community. We work with Monty and Bronx Lebanon Hospital, and we identify, and staff do go out to private MD's office as well as clinics to do health education, because that's not one thing covered in medical schools, and that's one thing we're pushing for. The tropical, travel medicine is important and should be covered there. So by creating this tool, any provider, any doctor can go on, and it will tell you for the person. So you could put in that you have a 20-year-old patient who's pregnant with diabetes, and it will give you specific instructions for what to prescribe, the medication and the dosage. So that's why we need to get this word out to providers as well as the community.
Mr. Melford?
Good morning. Is there a social media component to your outreach? I think using social media would be a great way to reach some of those people you may not see at some of these public places. And it's an easy way for us to share that information with some of our communities.
So I think we might have, I don't believe we have a very strong social media presence, but that is something that we think might be very useful in the future. And so if so, we will I believe we have, there should be, there's probably a Facebook page for it, and then, but I'm not sure if there's, oh yes. So we can, you can find us on Facebook and Twitter, but we're not in control of those accounts, so we can't personally update them, but we could refer people to those social media sites, yeah.
That's a great idea, and we have to look. And I know I tweet and I use the hashtag Heading Home Healthy and tag things to try to get, but we should look into having our own, yeah.
Thanks for the suggestion.
You're welcome.
Can you, I know some of the concern around the vaccinations are around the expense and cost. Is there any connection between getting something low cost? How do you address that, if at all, the expense of the vaccinations?
So for typhoid fever, there is a vaccine, but it is expensive, and really the Department of Health has no way of providing services. We do work with Bronx Lebanon Hospital that has a travel clinic, and they have a sliding scale, so they are able to, at least the visits and all, some kind of way is covered under insurance, but the vaccine is not. For malaria, it's medication, and most health insurances do cover medication for the prophylaxis.
I know there was, sorry, did you still have a question?
Any questions?
Also, we will hang out to the end of the meeting in case anyone would like to talk to us afterwards.
Okay, thank you so much.
Thank you.
Next, we're going to hear from Safe Horizons. So we'll give them a few minutes to set up. Well, the mic is wireless, so you should be able to hold the mic.
So thank you, everybody. Like I said earlier, my name is Nora Moran. I'm the Policy Director for Government Affairs at Safe Horizon. I'm here with my colleague Maureen Curtis, who oversees our criminal justice programs. And we are here to talk today about one of our newest programs, the Crime Victim Assistance Program, which we're really happy to report is now citywide. So I'm going to give a very brief overview of who Safe Horizon is and what sorts of work we do in the city. And then I'm going to turn it over to Maureen to talk in more detail about CVAP, which is what we call the program. And then we'll take any questions that you all have at the end. All right, so Safe Horizon, we are the largest victim services organization in the country. We work with almost 250,000 New Yorkers every year, and we primarily serve victims of crime. We will work with people who have experienced any type of crime, but primarily we work with folks who have experienced domestic violence, sexual assault, human trafficking, child abuse, and and then also just general crime. We provide trauma-informed, client-centered services, meaning that we, in all of the work that we do, we try and think about and understand how trauma might be impacting this person. As we know, being a victim of a crime can be very traumatic. And we are client-centered, meaning that we are always going to take direction from what the individual expresses that they need and want in their situation, rather than trying to direct them in one way or another. We often say that clients are the best experts in their own lives, and they know what they need. We do a lot of education and outreach to the community, both directly to crime victims, to organizations that might work with them, to other providers to help them understand how to work with crime victims. Much of our work is done in partnership with other systems in the city, so we work very closely with the courts, with the NYPD, with legal providers, with housing providers, behavioral health services, making sure that crime victims have access to anything that they might need to help them recover. And we also do quite a bit of advocacy work, trying to shape programs that help our clients and help crime victims broadly. And so we do this work at more than 100 sites in New York City. Our staff are working in police precincts, they're in courts, they're in confidential domestic violence shelters, they're in community offices, and our staff will do all sorts of things for clients. A list up here of just some of the things that they might assist with are safety assessments and safety planning, information about their rights and options as they're moving through the legal system. We will provide free legal services in certain circumstances, assistance with emergency shelter, lock changes, services for children. We have a counseling center, and the list goes on. But that just gives a sense of the kind of work that Safe Horizon does and where we're located. And now Maureen's going to talk about our newest program, CVAP, and what this program looks like in the Bronx, and sharing just information about it with you all so that you know that it's a resource in your communities.
Thank you, Nora. Good morning. Thank you so much for inviting us here to talk about this really exciting program. So CVAP is a program that I have to say first is based on a program where we have partnered with the NYPD since 1984. I actually started my career in 1987 working in a police precinct here in the Bronx. So through those years of working in this program, it was called the Domestic Violence Police Program, we really gained a lot of experience in what it means to work side by side with police officers where they are actually working in police precincts. CVAP, which is now funded by the NYPD, and it's through the First Lady's Thrive initiative, that's where the funding comes from, now has 2 advocates in every single police precinct. There are 6 precincts citywide that only have 1 advocate, and that's based solely on need. They're the quieter precincts. Every single Bronx precinct has 2 advocates. So in that way, it's different than the Domestic Violence Police Program, which it's modeled on, because DVPP, our focus was working with victims of domestic violence. This program, not only is it citywide, in our most robust with DVPP, we were only in about 26 police precincts citywide and the housing precincts. This program is citywide and assigns a crime victim advocate as well as a domestic violence advocate to work with the police, no matter what the victimization. And as of, it was rolled out over 3 years. It started in 2016 where we moved into 29 precincts. 2017, we moved into 26 additional precincts. So in 2017, all Bronx precincts had 2 advocates. And then this year, 2018, by August, we moved into all the housing precincts, the PSAs, and the remaining police precincts. So now, as of August, every precinct has 2 advocates, except for those 6 precincts which I mentioned. So what do? This is a unique program for a couple of reasons. The reasons that I just mentioned, I mean, there's a lot of programs across our country and across our state that have advocates working with police, but this is one of the few where advocates work in the precinct with the police officers. So they actually go to work in the police precinct, which really helps you to build a relationship with the police that's different than if you're working with them outside the precinct. The program is three-pronged. First and foremost is our work with victims of crime. Second is community outreach, and third is police training. So the first, just to give you a sense of what the day is like for our advocate, and just to say that all Bronx precincts, every precinct, there's an advocate there from 8 in the morning till 8 at night. So we have one advocate that works the tour 8 to 4, another advocate that works 12 to 8 with a 4-hour overlap. The crime victim advocate and the domestic violence advocate have specific work in terms of their outreach to victims of crime, but if any victim comes in, so if a victim of domestic violence comes in and the domestic violence advocate is not there, the crime victim advocate is trained in how to provide services for that domestic violence victim and vice versa. In terms of our outreach and based solely on volume, it's really shocking how many police reports. There's probably close to 700,000 crime reports, non-domestic violence, each year in New York City, and close to 300,000 just for domestic violence. So our advocates come in, when they come into the beginning of their tour, they get all the police reports from the day before, maybe 2 days before, and they review them. We train our advocates how to do an assessment just by looking at that police report. So for example, a domestic incident report, which is a crime report that's filed when it's a domestic violence incident and the police have responded, on the second page, the victim writes their statement about what happens. We train our advocates, read thoroughly that police report, including the victim's statement, because maybe under the law, it was written up as harassment, but in the victim's statement, she says, he threatened to kill me by stabbing me the last time. So in terms of how it's written up as an offense this time, it's harassment. It could even be a family dispute. But by reading that, they now know before they've even outreached to speak to that person how to engage and how to consider that in their assessment. So the most important thing is doing outreach. We do outreach every single day. I will say that this is a unique program for another way. Probably 70% or 75% of the contact we make with victims is over the phone. And this is unique for many service providers. Many service providers, including Safe Horizon, the person is coming seeking services. Even our hotline, which is contact with the victim over the phone, the person's calling us seeking assistance. We're reviewing the police reports and we're outreaching to that person to say, we know that there was a report filed for harassment or an assault, whatever that is. Do you have some time to speak with us? We'd like to talk with you about your safety, about options, about services that may be available for you. And all of the services that were mentioned in the previous slide that Nora spoke about are the services that we could be talking about that are specific to that person. So that the advocate may talk about an order of protection because that's what one victim wants to speak about, but for another victim, seeking safety may be going into shelter, and that's what we'll talk about with that person. We meet with victims at the precinct. We're hoping that once we're fully embedded in the precinct, it takes a little time to get in there and for them to know us, that any time a person comes into the precinct to talk to the police, whether they're there to file a report, whether they're looking for information, if it's something that the advocate can help with, because we can talk with them to help them decide, do they even want to file a police report, that they're going to refer to the advocate. So we're hoping that we're going to see more walk-ins, and we're available anytime we're there, no matter what the need is. The other unique thing about this program is we do home visits with police officers, and we are skilled in doing this. We've been doing them for more than 30 years with police officers, going into domestic violence homes, and now we're expanding that into doing home visits with police officers. Maybe there's an elderly person who was the victim of a scam, but can't leave their home. We may go out with a detective and speak to that victim in their home. Or a person was a victim of a burglary, and we may go out with a crime prevention officer to speak to them about securing their apartment by putting locks in their window. And as Nora mentioned, we provide client-centered services. Our goal is meet the client where they are, meet their needs as best as we can, and then explore where we can connect them to. Is it another Safe Horizon program? Is it a local community-based organization? And that's what we are going to do. And then we're going to follow up with them to see, did that referral that we gave you, was that helpful for you? And then we do a lot of advocacy. We're going to mention in our last screen some of the training that we provide for our staff. Advocacy is a big key for us. I'm a big fan of Law and Order type shows, but they're not realistic, and I think that knowing what the criminal justice system can and cannot do for you, and then helping to navigate that, helping that person, if they didn't get a copy of their order of protection, obtain a copy of their order of protection, because where we sit, whether it's in the police precinct or the courts, we have access to be able to help our clients get something that they may be able to get on their own, but they may have to take a few extra steps to do that. As I mentioned, this is a three-pronged program. We do a lot of outreach. We table at community events. October is Domestic Violence Awareness Month, so we're out in the community. You may see us out with the police on street corners or at different school events. Anywhere people want us to come, we're going to come. Presentations. We can do presentations such as this, where we come and we talk about who we are, what we do, how we can work closely with you, and the services that we provide. And then on a smaller, we do training. So our expertise, for example, is the criminal justice response to victims of domestic violence. So we may, if you wanted your staff to be more knowledgeable about that, we could come in and we could speak to you about that. Housing options for victims of domestic violence. So these are the different trainings that our managers and senior level staff might do. Sometimes advocates, but they're usually doing more of the presentations and tabling. And then the advocates will enhance the police officer's sensitivity. We speak at roll call training. If any of you are familiar with roll call training, you're literally up in front of the officers for 5 minutes. If you're lucky, you get 10 minutes. And from our years doing this, we are skilled in how to sensitize police officers in 5 minutes. Whether it's playing a 911 call of a child calling and talking to them about the impact that they can have when they respond as patrol officers to that child in the home, to recognizing a police officer who, Mary told us that because of Officer Jane, she was really happy and she felt that the police department cared about her, mentioning that at roll call, so now it's a way of acknowledging the officer. So not only are we sensitizing them to victims' needs, we're also building relationships with them at the same time. And then lastly, the training. We often get questions from the community as to what type of training do we provide and what's the skill level of the advocates. In the previous slide that Nora showed, it said that Safe Horizon has more than 100 sites citywide. That actually is closer to 200 now if you count every precinct that we have 2 staff in. But most of our staff have a bachelor's. They're not social workers, they're advocates. They have a bachelor's degree. We will take somebody who has an associate's if they have experience. In some cases, even somebody who doesn't have an associate if they have the experience. We're really looking for people that can work with a diverse population, that can be compassionate, that can work side by side with police officers. It really is a unique job. Working in a precinct, it's shared space. You don't have your own office. It can be loud. It can be dirty. And when I say dirty, I mean dirty in terms of, some of the buildings that they're in are not the cleanest, it's not the environment for everybody. If you're the type of person that wants to, work behind a closed door when you're seeing your clients, it's not the job for you. But if you're the type of person that sees the value of talking with a client, even though there's police officers milling about, where you know that because you're there, you're helping to make it safe for that person, that's the job for you. So we do 40 hours of client-centered practice. As Nora mentioned, we, about 10 years ago, Safe Horizon changed into our new practice called client-centered practice, and we train all of our staff once they're hired in this. And it's not just 40 hours, there's skill building as they move forward in their work with clients. It's supported in ongoing training, and it's supported in individual and group supervision. We have 157 advocates. I just want to mention the supervisory structure because I think that's critical as well. We really believe that you cannot do this work without good supervision. So there are 21 managers who report to 3 senior directors who reports to an associate vice president. They receive training on understanding vicarious trauma. I've been working with Safe Horizon for over 30 years. It's only in the last 10 years that we started to acknowledge that we need to look at vicarious trauma. This is tough work doing the work that we do. Navigating your successful career at Safe Horizon, managing interpersonal conflict in the workplace, and some of these are ongoing and some of these are done when they're first hired. Child abuse mandated reporting in a client-centered practice. So everybody receives the 2-hour state training on child abuse reporting because we're mandated reporters, but then we do an additional 3-hour training with our staff. Well, what does it mean to make that report in a client-centered way? Because sadly, when we do have to put on our mandated reporter hat, it can be upsetting to our clients. So we want our staff to know, how can you do, they have to do it because they're a mandated reporter, but how can you do it in a client-centered way? Using a trauma lens to understand challenging client behavior, we know that sometimes that escalated client, that client who comes in and is angry and upset, is often responding to their trauma or responding to maybe some of the helping systems may have treated them, and how do you manage that so you don't get caught up in that? Making the most of your supervision. We talk to our staff about the importance of supervision. All of our staff input into a client database, and they're all trained on how to use that. They receive support around that. Since the beginning, our first 2 years, we identified 70,000 clients citywide just in the CVAP program. And that's where we made contact with them, did an assessment, and provided services. And then lastly, we do a lot of need-to-knows. So for example, my expertise is the criminal justice system and housing. I do a 3-hour training for all of our staff on housing options for victims of domestic violence, navigating the criminal justice system. We have another person that comes in to talk about, how to work with other victims of crime, how to work with male victims of crime. Interestingly enough, since through this program, we're seeing more men victims. And we've been starting to analyze that, and we think that, it's part of our culture that men don't seek services when they are a victim of a crime, but yet if we're outreaching to them, they're more likely to engage with us. And the need to know, we do the critical ones right from the beginning, and then we do them on an ongoing basis. And one of the things I will say about the training is, it's not just one day of training, that's it. We talk to our supervisors about how are you supporting your staff in now how they're applying that training to the work that they're doing. Any questions?
Yes. Can you describe or give a little further information regarding one of the terms that you used? You said vicarious trauma. Can you explain that to us?
Sure. So vicarious trauma is the trauma that a worker will experience from working with, a difficult area such as this. We're working with crime victims. So for example, vicarious trauma could be I work with, let's say I'm working with a person who comes in who's been severely beaten by their partner, and now I take that home with me and I start having, nightmares, or I start thinking about, what has happened, and maybe it's even bringing up some of my own trauma that I may have experienced. Sometimes, a lot of times vicarious trauma over the years has been referred to as burnout. A person has been burnt out, and sometimes it can be burnout, but what we're learning is that often if that person receives that support, and when I say support, self-care, we talk with our staff about what does vicarious trauma look like, and for example, it may not be acute. It could be what they call chronic vicarious trauma, where how you view systems, how you view victims in general, is a form of vicarious trauma. But, taking care of yourself and recognizing it is really a big step. And we have a separate training for our supervisors as how to acknowledge it, because sometimes that performance issue, somebody coming in late every day or calling in sick all the time, that could become a performance issue, but maybe it's connected to vicarious trauma.
Thank you. I saw Mr. Melford's hand first, and then followed by.
So I thank you both so much for giving us all of this information and for being so thorough. But I wanted to know, are you guys sharing this with other major cities? Is this model being used in other places where we can help victims across the country, not just here where it may be one of the more commonly heard about programs, in a place where it may not be well reported or as reported as New York City, but would benefit from having the same model?
I will say that, when, this program went citywide back in 2016, when we got the funding, we presented at a few national conferences. One of them that we presented at was the International Association of Chiefs of Police, where there's representatives from police departments, not just across the country, but across the world at this conference. And there was a real interest in this program. We've also presented at a couple of the domestic violence conferences across the country. And we created, I think, that's kind of like connected to this, how to be client-centered in working in the criminal justice world. Because if you're saying you're going to be with where the client is, but then there's a mandate to make an arrest, or there's mandate to, prosecute, and sometimes that mandate is based on a law, how can you be client-centered? And we've learned a lot from our work in the police that we're sharing now, and we presented at the State Office of Victim Services Conference, and we are actually hoping to present at another national conference in Texas to talk about this work that we're doing. Because I really believe that while a lot of police departments across the country are doing similar work, nobody's doing it in the way, or very few are doing it in the way that we are. One, the police departments that are working with victims of crime are working with sexual assault victims or domestic violence victims. We're probably the first first agency to work with a police department working with all victims of crime. And we're the largest victim services agency, as Nora pointed out, working with the largest law enforcement in the country. So, I will add that we took out of this presentation just to make it shorter, but we're actually looking for funding because, to your point, we want this to go national. We want this to go worldwide. We want to be able to do a robust study on this program to show that when you have this type of program, it makes a difference in victim services, and it makes a difference, I believe, in community police relations.
Mr. Faulkner.
Yeah, thank you, Deputy. I was wondering if you could comment on the current process for getting an order of protection and whether your precinct-based people will eventually be involved in that process. And the reason I'm asking that, we recently referred a constituent who needed an order of protection, and it was not a smooth process. She was referred to the court, she got to the court, at 4 o'clock and was told that, well, we closed now because we've got to process paperwork. She was never given an additional referral, went back to the court, was told there was some additional information that she needed, had to go back. And in the meantime, this was somebody who desperately needed an order of protection. I don't know if this was a one-off and this was just an unusual practice. Is this something that you're experiencing as common when people need to have and would a solution be, because I was interested in this precinct-based person, because if this person had been referred to the precinct-based person, would they have been able to assist in expediting the issuance of this order of protection? Because it actually took several days to get this process done. So is that common? Hopefully it's not. Or is that something that we need to take a look at to see that this process has moved a lot more quickly?
I'll respond to that. I'll turn it over to Nora because she's actually, on a larger scale, we're looking at this with somebody's office.
Yes.
Sure.
Yeah, so a couple things that I would say to that. Sometimes clients do face challenges in getting orders of protection. The court is only open, family court, if it's in family court, is only open from 9 to 5. So if somebody needs it after hours, they have to sometimes wait until the next day, or they have the option of going to criminal court to get an order. But if that happens, they'll still need to go back to family court the next day to get that order of protection in family court. So it's an extra frustrating step. Previously, there used to be night court, so courts were open later, but I believe there were budget cuts at the state level that scaled court hours back. This is something that Safe Horizons always raised in our state-based advocacy, and we'll continue to do so. So that's one piece of it. The other piece is that sometimes we see folks have challenges around language access when they go to courts. And so, we've always talked about the need in courts for greater language access, having an interpreter there, but then also if it's appropriate and there isn't an interpreter there, could you use language line or some other, mechanism to do the interpretation and get that person that order of protection right away? So there's a couple different solutions. One is making sure that people are aware of court hours, informing them that they do have that option of going to criminal court if family court is closed. Another thing that we've also tried to do, we would encourage folks here to do as well, is to educate folks on the New York City's paid safe leave policy. So now if somebody has to take time off for domestic violence matters, like going to court, seeking legal services, their paid time off, paid family leave can count for that. That's like excused absence, if you will. So that's another thing we've tried to do, because we have seen people say, oh, I have to take a day off, I can't afford to do that. So letting people know that that's an option. And I have more detail in an email that I am going to send to you today, but thank you so much for raising that.
There was one point where they said that there had to be an engagement with the person who was victimizing her as part of this. I don't know if that was accurate, but that...
That's inaccurate. Okay. The person does not have to be engaged with the person, and unfortunately, and this is why having victim services in the criminal justice and civil systems is important, because they're very complicated systems. I would say
actually it was the courts.
I'm sorry?
Actually, it was the court had to engage before they issued the order of protection. They had to sort of
speak with the opposite party.
Yes.
Yeah, that's not true. So basically what happens, just in a nutshell, if you want to petition for an order of protection, the family court right here, 900 Sheridan Avenue, Safe Horizon has an office. We're there from Monday to Friday, 9 to 5, right on the first floor. I would ask you, send anybody that needs to petition for an order of protection to our doors. We will help them. Sometimes if they come in late, because of our relationships with the clerks and the judges, we may be able to get them to accept a petition at 3:30, 4 o'clock, where if a person just walked in off the streets, they're not going to do that. So, we can definitely help navigate them, but taking a few days should never have happened. If they came back the following day, they should have been able to petition for an order of protection. Now, of course, there's no guarantee that the person's going to get the order of protection. It's up to the judge whether or not they believe there's sufficiency enough to warrant an order of protection. And I will tell you that coming soon in 2 Bronx precincts, don't quote me, but I believe it's the 4-5 and the 4-8, we are going to be doing remote orders of protections from the precincts. And what that means is that the person can do the petition in the precinct with our advocate, and it'll be video conference to the judge, where the judge will issue what's called an ex parte temporary order of protection. All the paperwork will be emailed to the advocate to give to the person, and the summons goes to the sheriff's office to have it served on the person who's abusing them. But we're anticipating that will come into, well, we were hoping before the end of the year, but it's looking more like it'll be early next year.
That should be borough-wide. Well, I don't know why, I'm sorry, but, I don't know why that's not.
Mr. Dudley, you had a question?
Good morning. John Dudley, District Manager, Community Board Number 3 in the Bronx. Let me just say, if I heard you correctly, how many individuals you said were assisted? Did you mention 250,000 persons that were assisted?
At Safe Horizon, yeah.
That's statewide or citywide? Do you have that broken down? Is it broken down by precinct level? Is it broken down by zip code? How is that data collected? How is it reflected?
I don't know the numbers off the top of my head, but we do have it broken down by borough, we slice that information in a whole bunch of different ways to understand what our services look like per borough. So if that's something that folks are interested in, we could follow up with you by borough, I think we have it by community board, definitely by council district. So we could follow up and send it to you.
That would be interesting. If you do have it by community board, just to give us a sense of understanding as to the nature of how many victims we have, crime victims, domestic violence, and so forth, that would be helpful. You also mentioned, I'm sorry, there were about 100 different locations that were sites, right? Say precincts, the PSAs, the courts. Do you have the locations that you mentioned, those would be locations that you have staff at? Do you have those also broken down by either district level, precinct level, and so forth?
Yes, so the paper that I passed around was information about our Bronx-based services.
Okay, so these would be then the sites of the 100. These would be sites that are located in the Bronx exclusively.
Yes.
So there are no other sites other than these that are listed here that would be in the Bronx, or?
So that's an exhaustive list of everything that's in the Bronx. We have programs in all the other boroughs, which I didn't list here because I figured it wasn't relevant for you folks. But if you are interested in seeing it, we can send it. We also do have shelter programs in the Bronx, but those sites are confidential, which we have not included for obvious reasons.
Yeah, those are the confidential HRA, domestic, for victims of domestic violence and so forth.
Yes.
The community offices that you have listed here, what would constitute a community office where you would have staff at? Give me an example.
Sure. So our Bronx Manhattan community office, so we have one office that's in Upper Manhattan that serves folks from the Bronx and Manhattan. So it looks just like a regular office. You walk in on the ground floor. There's a reception area for kids. There's rooms where we do groups, things like that. That's more of a, people can just walk in and receive help if they're not, because not everybody also feels comfortable walking into a precinct, walking into a court. We're aware of that, so we have those offices to just exist as a neutral third space where people can interact with us.
Thank you so much.
Sure. And I would just add that probably not on the list, there are some programs that are located outside of the borough but serve citywide. So our anti-trafficking program, they're located in downtown Brooklyn, but they serve traffic victims throughout the city. The same with our hotlines. So there are some that are citywide services.
Ms. Hill?
Just for clarification, and I will use the term victim, I don't know if that's the proper term or not, but is the first step for them to go to the police department to file an order of protection, or can they come directly to your offices if they're in a situation?
If a person wants to petition for an order of protection, they shouldn't go, and they're sure that that's what they want to do, they don't need to go to a police precinct. They can go to the family court office and they can speak to a Safe Horizon staff person in the family court office who is going to be skilled in where we do the online petition. So we'll do the petition with that person, and we will then walk them through the process. We will do safety planning with them. We will talk to them about the sheriff's office who will serve that summons and what that looks like. And we'll talk with them about safety options once that summons is served. You know, if the person comes into the precinct and they're not sure what they want to do, and after the assessment it's determined that they really want to petition for an order of protection, the advocate is going to then link them to the Safe Horizon Family Court office so that that person can help them through that process.
Ms. Ganti?
Thank you, Madam. Thank you. Again, just for clarification, if you could help me, when you use the term domestic violence, is that a broad enough definition to include elder abuse and child abuse? It's a big umbrella, domestic violence, yes?
Yeah, so, you know, so domestic violence for some organizations, it could just be intimate partner violence. For some organizations, it could be just elder abuse. For the purposes of Safe Horizon, for the most of our programs, it is all violence in the home, elder abuse, family violence, so violence between cousins, between siblings, between parents and child, but they're not elderly parents, and intimate partner violence.
And just one last question. If you could give us a sense of the trend where domestic violence, how you define it, where is the trend going over the years? If you have Bronx information, that'd be great, or citywide.
That's a really interesting question. I sit on a couple of committees citywide, and I have worked, as I said, with the police department for many, many years. And what's been interesting in the housing precincts, the PSAs, they cover the NYCHA locations. Historically, because we had funding, we've been in the PSAs since 1987. Historically, probably about 50% or more of the police reports filed for domestic violence are family violence, not intimate partner violence. And we're starting to see that increasing in the precincts, where it's happening more often that the police are responding more to family violence than intimate partner violence, to the point where the Mayor's Office to Combat Domestic Violence has changed their scope and their name. It's now the Mayor's Office to End Domestic and Gender-Based Violence, to expand their scope about who they provide services for, and also to look at what do those services look like. So a service for a parent who has a 17-year-old son who's, you know, they're calling the police on, looks different than the service for a husband who is being abused by their wife. So I think that this is something that, as part of this change, they are going to be looking at what are the needs of these different populations, and how are those needs being met currently in New York City, and what do we need to do differently. And sadly, I think we see it, you know, it starts as intimate partner violence and it ends up, I manage the Emergency Transfer Program, which is a program that the New York City Housing Authority had with Safe Horizon, where we helped victims of crime transfer from one location to another. In 1999, when I was going for my MSW, and I was in school, my research class, I evaluated the Emergency Transfer Program, because I had the ability, because I also supervised the programs, the police precinct program in the PSA, so I could look at the number of police reports. On average, I looked at 192 families in 1999 that had successfully relocated to a new home because of domestic violence in the home. I looked at them from either 12 months to 18 months after they successfully moved. Well, first, on average, they had filed 4 police reports before they moved. I then looked at them 12 to 18 months after. 79% of the families didn't file new police reports. So it showed the success of the Emergency Transfer Program. I mean, I wish that we were able to look at it more in depth. Sadly, what I did see was, of the 21% that did file a police report, 30% filed it against their children. So we're seeing that cycle of violence where, children often don't act out, on their own. There's often the trauma that they've been through, and sometimes that trauma is intimate partner violence that's going on in the home.
Mr. Melford.
Does Safe Horizons offer victim training? So let's say I was a victim and I now want to be a liaison and advocate for Safe Horizon. Does Safe Horizon offer an opportunity for that victim to now get trained, not being a staff, but as a victim, so that they can continue providing service in some capacity?
Sort of. So I'd say two things. We do a lot of training with other community-based organizations in the city who are also providing domestic violence services, whether they're just focused on DV or they're a community-based organization doing lots of things and want understanding of DV so that they can address it in their work. So if someone was employed by one of those organizations, we certainly could do training that way. We also have a program that we call our Speakers Bureau. So it's made up of former clients of Safe Horizon who sort of volunteer their time to advise our organization, to act as spokespeople in their own communities, talking about what they've experienced and why it's important to address violence in all forms. So that's another way that we work with folks. But in terms of just a generic training for community members of any background, we don't currently offer that, but who knows? We are always expanding our work and doing different things, so it's something we could consider.
I was thinking specific for victims, crime victims.
Right. That's, yeah, I mean, we certainly could think about it. It's a good suggestion. Thank you.
Mr. Brown.
Thank you very much. Thank you, Deputy Borough President. Thank you very much for, sensitizing us to a vital issue. I have two questions, please. One is to piggyback off Mr. Faulkner's question. It was a little distressing to me, if I heard correctly, that there was no automatic referral to the advocate at the precinct when there was someone petitioning for an order of protection. And I was wondering, why isn't there automatic, if you will, engagement with the in-precinct resources when people should be or could be seeking an order of protection? And my general question around that is can you step me through what the process is to engage with a potential client, the service delivery, and then the discharge? That's one question. Another question is, I'm really interested in, do you have any barriers that you're aware of in terms of engaging with people that have English as a second language, foreign-born, relatively isolated communities? And in particular, the reason that motivates that question is there's a program in Berlin, Germany, that I'm really interested in and intrigued by called the Stadtmutter program. And that is a program in a particular neighborhood in Berlin now too, where they do training for mothers in families that have low-level German language engagement. And it's to teach mothers, train mothers so they become municipal employees to reach out to other mothers in the same community to try to enroll their children in early education so that they could be mainstreamed to German culture. And when I heard about this program, I thought, oh, this might be a really useful avenue towards domestic violence. So can you talk to the engagement process with your staff and the clients, and also what barriers are there to engaging foreign-born and English language difficulty populations?
So I'll start with your first question about the order of protection. Referring to an advocate in a precinct, if the person wants an order of protection, isn't the place to go, because that advocate doesn't do the petition. So if somebody is referred to the precinct and they after the assessment, they decide that to keep themselves safe, they want an order of protection, they have to then go to family court. So the advocates don't do the petitions. We're piloting something in 2 precincts that will, but that's only 2 precincts out of 86 precincts citywide and none of the PSAs. And the family court staff, our staff, have extreme knowledge in how to navigate that system, and they have relationships with the clerk that can really make a difference in that person getting what they want. So for example, what they put in that petition is critical because the person goes in front of the judge may not ask them a question. So if they don't put enough information into that petition and they're looking for an exclusionary order of protection, the judge may say, well, it's not violent enough and the children are not being threatened, so therefore I'm going to give you a limited order of protection and both parties can stay in the same home. You know, and then the person comes out of the courtroom and says, oh my God, what just happened? They're letting him stay in the home with me? So I think that this is something that by seeing a Safe Horizon staff person in the family court, we're going to talk with them and then help them write up the petition. In terms of linguistic needs, before we moved into any police precinct, we did a survey of the language needs of those communities, whether we were looking at demographics of the area, the census, speaking with the headquarters 1PP, calling the community relations officers in the precinct. We really tried to meet the language of the precinct. So for example, in the Bronx, most of our staff, and this is all Bronx programs, speak Spanish, are fluent in Spanish and English. And in the precinct program alone, not including other programs, we speak citywide, our staff speak 18 different languages. If the staff does not speak the language, because we know we're a very diverse city, they use a language line. Language line in New York, in the NYPD, where we have access to that through the NYPD so we can communicate with that person. And then probably just as important, once we move into a precinct, the managers and the advocates are given the task of not just doing everything here, but get to know your community. Who's that small community-based organization, that cultural-based organization, that faith-based organization that you should know in your community that can provide services that may help that person? Because to your point, a person may present in a mental health clinic, a person may, present in an ESL class, that we want them, to be aware that that person could have, could be a victim of domestic violence, and not that they're going to be the experts and provide the services, but they're going to connect to Safe Horizon, even if it's just knowing our 24-hour hotline. We have 3 of them: crime victims hotline, sexual assault hotline, and the domestic violence hotline, and they're all interconnected. So if you only remember one number, they'll get to the right place.
Just one other quick point that I'd say to that. We are aware that not everybody in New York City is going to come to Safe Horizon for services. We're a huge city. There are folks that just might not feel comfortable seeking services from our organization, and that's fine. We do what we can to partner with other domestic violence, community-based organizations in New York City to make those referrals, to know who the appropriate other places are, who's trusted in the community, what is this person looking for, and if we can't provide it, maybe someone else can. We actually partner with the City Council to administer their DOVE initiative. So we contract now with over 100 organizations across the city that the council designates as saying, in my district, this is who is doing domestic violence work and who is having a program and building that out. So we will do the contract with them, administer it, et cetera. But it's also really helpful for us because then we learn about groups in the community that maybe we didn't know about who are out there offering services to victims of violence, and then we can share that information with our staff so that if somebody needs something that we don't offer or is looking for a specific, they speak a specific language or is from a specific background, we can make a referral to somewhere that they might feel more comfortable. And it's really, that program also has just really helped strengthen the city's response to violence as a whole. So we do what we can to work with other groups.
Before we end, can I just give a real shout out to the Borough President's Office? I don't know if you all know, but We applied for, through the Borough President's Office, a grant through OVW, $900,000 that we were awarded. So it's supporting staff in the Bronx District Attorney's Office, Safe Horizon, and Bronx Department of Probation. And then for Safe Horizon, it gives us 2 new staff to work in our criminal court program right across the street here, and one of them will spend part of her or his time in the Department of Probation offices.
Well, the Borough President's Office always enjoys a shout out, so thank you. No. Ms. Saunders, I'm sorry. Your name escaped me, even though I was looking right at it.
Thank you. My question just pertains to a time frame, and that is the time that you request an order of protection. How long does that take for that to become effective? And also the length of time that is in the works. In other words, the termination. Is it ever terminated?
So the order of protection, you can get an order of protection 3 different ways: through Supreme Court, criminal court, family court. Supreme Court, it could be through a felony crime, or it could be through matrimonial court. The most common way is criminal court or family court. In criminal court, it's issued at arraignment, and in 99.9% of the domestic violence cases, an order of protection is issued. It's good from court date to court date, so as the defendant moves forward in the court case, the order of protection is renewed, and then at the end of the court case, depending on what the final charge is, what the person pleads out to, is convicted of, the judge will, in most cases, issue a final order that could be good for anywhere from 1 year to 5 years, depending on what the final charge is. In family court, different than criminal and supreme, the person has to walk into the court and petition for an order of protection. So the order of protection is driven by the victim herself or himself. They go in there, they petition, they should get it same day. So, but of course, if they come in late in the day, they may be told to come back the following day, and there should be no reason why they don't get it the following day. And then it's good until the next court date. The important thing to keep in mind with the family court order of protection, to answer your question, is the family court order of protection is not valid until it's served. So I go into family court, I get an order of protection against my partner today, and the sheriff doesn't, let's say I have the sheriff serve it, the sheriff doesn't serve it for 3 days, and something happens tomorrow. If the order is not served, then it's not going to be valid, and it can't be violated. But once it's served, it's good from court date to court date until that, same thing with criminal court, until the case is completed and a final order is issued. And then in family court, it's up to the judge what the terms of the order are, whether it's exclusionary, whether it's limited, you know, and whether there's custody allowed, visitation. Family court, they can have more things written into the order.
Thank you.
And Mr. Wernicke?
Thank you, Madam Deputy. You mentioned family leave earlier. I just don't know if you realize that that's not an option for everyone.
I'm sorry, I mentioned...
Family leave. She mentioned family leave earlier, and I just hope you realize that that's not an option for everyone. Okay, thank you.
Good morning. I just wanted to ask whether you were considering moving this program into the transit police. I only see it at the precincts and the housing, and as you know, there's been a lot of incidents that have been occurring in our subway systems and on our buses. So I just wondered if there were any plans for that to occur.
Well, it's interesting. We have had some conversations with the police department. I have to give credit to Deputy Commissioner Susan Herman, who was instrumental in making this program happen and getting the money through the Thrive initiative. So we have been having conversations with them to expand either to transit, expand to the Homicide Bureau, expand to the Special Victims Division. So there has been conversations which we believe have been really meaningful conversations. So fingers crossed, but it's a lot of money to run the program. So what we want and what we get could be two different things. But definitely it's something that, the NYPD is talking to us about.
Well, we want to thank you for your presentation today. Thank you for your answering all of our questions. It's a very interesting and topic that we need to discuss. So thank you again.
Thank you.
I cannot hear you.
That's turned off. I'll be here until the end of the meeting if anybody has further questions.
Wonderful. Thank you.
I apologize, but I have to leave in a couple of minutes. Thank you.
Okay, so next we're going to move on to a presentation sort of from the Economic Development Corporation. So in terms of explaining what we're doing right now, part of the wonderful process of budgeting includes our community boards, meeting with various citywide agencies and discussing priorities throughout the borough, and also specifically to their respective community boards. So we often do these because they are very long in a different process, but because of I guess some scheduling issues, we were not able to include the EDC in those previous conversations around budget consultation. So we're happy to have the Vice President of Government and Community Relations here with us today, Charlie Samboy. And so this is going to probably look and sound different than any of the other presentations, because what we normally do is we have questions that we think of in advance that we know that we want the specific agency to speak on, and so we may be referring to those questions throughout the process. They've also given us some answers that we may ask them to elaborate on based on the answers that we have in front of us as board members and chairs and DMs. So again, this is sort of one of those government teachable moments where we get the curtain drawn back and we get to see some of the activities that would normally happen outside of this room. And so, are we ready?
Yeah.
Are we ready to begin?
Sure. Good morning, everyone. Again, my name is Charlie Samboy. For those that do not know me, I am a vice president in the Government Relations Department at EDC. I directly oversee all of our Bronx projects, and I supervise the folks that work on our Manhattan and Staten Island portfolio. And again, apologies, there were some scheduling issues on our side that I was not able to attend. I believe the September 25th Borough consultation meeting last month. However, I'm happy to answer any questions you may have, and I'll go through some of the questions that was sent to us as part of that Borough consultation process. The first of which was regarding projects that we've completed over the last 12 months. It's a bit difficult sometimes to analyze which 12 months you're speaking about, so I will keep that to calendar year 2017. And I guess just to pull that back a bit, so for some of the folks that may not know how the EDC operates in terms of the work that we do, I try to categorize them in several different buckets. One of which is we do capital infrastructure work on behalf of other agencies. So there are typically capital work that is extensive in nature that would require several different agencies to manage different contractors if they were to do it independently. And what we typically do is that we take on that work on behalf of the city but we do collaborate with those agencies and those communities to do that work. One example is right here in CB4. We are working, CB4 and CB1, we are working on an infrastructure project to completely rehabilitate the subsurface infrastructure and the street of exterior street beneath the Major Deegan Expressway. So a project of that magnitude would require DEP, Con Edison, the Department of Transportation, and various other agencies. And what we do is we take that work on behalf of the city, and we coordinate with those agencies. Other capital work that we do, our agency is comprised of various different professionals across many different areas of expertise, architects, engineers, and what we do is we lend that expertise to other city agencies. A large part of the work that we do in that side is for the Parks Department. It may have been announced, maybe not so flashy over the summer, but EDC is actually the managing entity that is doing the rehabilitation of the pavilion at the Orchard Beach. So the Parks Department is leading that effort, and they are the community relations sort of face of it. But in the background, it is EDC that is managing the contractor and actually doing the work. So there's a number of things in that realm that we do capital work on behalf of other agencies. Another aspect of our work, which you are probably more familiar with, is our real estate portfolio, where we either RFP or lease or sell properties on behalf of the city. In recent months, we've had the pleasure of having a groundbreaking for the YMCA in the Northeast Bronx. There we worked with ACS, that is an ACS property, which was now become an EDC property and subleased to that developer. In Councilmember Salamanca's district, we are working on the active demolition of the Spofford Juvenile Detention Facility, which will be no more, and we are hoping to have a celebration in the coming week to speak about the future of that site. So a number of the projects that we do are real estate based. There are also a number of assets that we manage in different neighborhoods. The core of that is in Community Board 2, also in Council District 17, where we oversee over 100 acres of property that is the food distribution center, and there we manage a number of tenants. And then two other categories which are more specific to the council and to nonprofits. We facilitate the relationship between the council that allocates money to nonprofits for capital work, and we liaise with OMB and that nonprofit to make a lot of that work happen. So in the case where a council member allocates Res-OA money to a nonprofit to do some capital infrastructure, repair a roof, do some upgrades, we are the ones that liaise with that nonprofit to communicate with OMB. And then we have a lot of other sector-specific programs. Together with the Borough President's Office, in the last year or so, we did a capital program with different nonprofits to help them understand how can they apply to either the Borough President or the Council, how can they be in a better capacity to apply for some of those funds. So I'll just quickly over some of the highlights of the projects that we've completed over the last year. As I mentioned, the Edenwald YMCA, we successfully got that through ULURP. We had a groundbreaking with the Borough President and the Speaker Hasty's office over the summer. The Spofford Juvenile Detention Facility, we also, with the collaboration of Councilmember Salamanca, was able to get that through ULURP. We are actively demolishing that facility and look forward to breaking ground early next year. For folks in CB9, the New York City Ferry launch, the Soundview route was launched this summer. One of the most successful routes that we've had up to this point. And that services the east side of Manhattan, 92nd Street, 34th Street, and then Wall Street. A ride that typically in the past would take someone 2 transfers from either a car to a bus to a train, lasting over an hour and a half, now is only about 40 minutes from Soundview all the way down to Wall Street for the same price currently as a MetroCard. And several weeks ago, we had a working session with community boards here and council members and others to discuss the future areas where we might look for, expanding that service. Just a few blocks from here, at 149th Street, we completed the ULURP for the Bronx Point project. I know the Borough President is extremely excited about the Universal Hip Hop Museum, and that is where we hope that it will be housed. That is anticipated to be a 2-phase project with 1,000 units of housing, over 60% of that which would be permanently affordable. with a number of acres of open space. In terms of ongoing projects, a lot of that is concentrated in our asset management portfolio. So we are currently working on a number of resiliency projects in Community Board 2 in Hunts Point to advance a lot of priorities as it pertains to resiliency, not just for businesses, but for residents as well. And we've had a number of meetings, not just with the community board, but with the community at large. And thankful and grateful for their feedback. We've actually been able to change the project quite a bit to be more responsive to the needs and concerns of that community. The Arthur Avenue retail market, again, thank you to the Bronx Borough President's office as well as Councilmember Torres' office. As part of their advocacy, we now have a $1 million budget to work on improving and enhancing that retail market, which is part of the larger portfolio of retail markets that EDC manages on behalf of the city. And there are a number of other projects in Hunts Point where we are lease administrators on behalf of the city with respect to those tenants. So we have Baldor Foods, which you may hear about. We have Crasdale, Anheuser-Busch. There's a number of tenants there that there really isn't work on our behalf that's going on, but we simply on a day-to-day basis administrate those leases. Should I stop there if folks have any questions about sort of our core real estate portfolio and asset management portfolio?
I think that's a good place to stop for questions.
Okay.
Thank you. In fact, are there any questions? Councilman?
Good morning, Charlie.
Good morning.
So I know that 2 weeks ago we had a Hunts Point Vision Plan meeting, and I just want to ask some of these questions again. But first, before I go, there's something that's not in my district, the Arthur Avenue Retail Market. I know many of us may go visit. I know that council member, this is in Richie Torres' district, my good friend. He allocated about $1 million. I see that the mayor allocated $540,000. What's the status with their bathrooms there? When is the city going to actually start renovating those bathrooms there?
So we had an allocation from the mayor, I believe, last May or so. It was a commitment made in May, but it wasn't made real until the September capital budget plan was modified. Again, the borough president allocated in this fiscal year, in the previous fiscal year discussions, which will be active now, $1 million, and the council member allocated $108,000. About a week ago, we had a call with James Rouse and Marlene Cintrone of the BOEDC, who has been a big advocate of that market, and we began discussing the priorities for the borough president's office with respect to the work that's going to happen there. So what we are looking at doing is taking the $540,000 that was allocated by the mayor, and that would go to renovating both the bathrooms that are on that mezzanine level. We would add, as is required by city law in city-owned buildings, for there to be an ADA bathroom on the first floor, and then we would look to clean up and fix the floors. In the coming weeks, I will be approaching the market co-op, and we hope to begin implementation in the next several months. What that will require is for us to put out a bid to a contractor to get us back a price. Once we have that, we can then move forward with contracting for that, getting comptroller approval, and moving forward. But we hope to do that in the coming months to get motion on that.
So is there a set timeline, like a set date when you're planning on putting out this RFP? I mean, look, let's be honest, because I'm going to get onto some of the stuff in the Hunts Point Vision Plan. EDC has a tendency to say in the coming months leads to years. So is there a timeline as to when EDC plans on actually putting out this RFP?
I don't have a timeline right now. I am hopeful that we can get it out before the end of the first quarter of next year.
All right. The alternative fueling station in Hunts Point. This is a project that I've been working on for the last 10 years, Charlie, 10 years. What's the status? When are we going to move forward on this project? And what's frustrating is that within that 10-year process, the issue was always the financing with the developer that EDC chose. And then just 2 weeks ago, we found out that the issue is actually now you have two issues. You still have an issue with the financing, and Con Edison is an issue. So can you explain to me why did EDC wait to this very moment, to the last moment, to tell us that the issue with moving forward with this project is Con Edison now?
The issue with the financings have been resolved. The backstory to that is essentially, this is a project that predates this administration. As a council member mentioned, it's been 10 years in the making. Much of the land in the food distribution center is mandated by state law to be used for agricultural or market purposes. Because of the advocacy of the community board and others, we were able to rezone a piece of that property to sort of get out of that state mandate, and we were able to get a proposal to do a alternative fuel stations. What that means is instead of a truck using conventional fuels and driving around the city and the Bronx, spewing out all kinds of different particulate matter, they would use cleaner fuels, or there would be electrified vehicles that would be going into the market and out, essentially providing, or at least not contributing to further health hazards in the Bronx. That project required a number of financing in order to make it happen. It was not fully financially feasible using private money, so the city had to step in and add money to that project. In recent years, under the leadership of our new president, James Patchett, we began to look more closely at the contract, and we found that there were not sufficient provisions in the contract that gave the city enough teeth to mandate that well into the future the developer of this property would continue to provide certain fuels. And what that means is, if in 5 years they found that it was financially infeasible to continue to sell alternative fuels because the market wasn't there, they can then switch to and sell regular fuels, which is not something that we envision, nor does it provide any benefit to the community. There was a several-month holdup where our president requested that we modify the contract so that the city has more of an ability to mandate that they stick to the spirit of it being an alternative fuel station, and that created a significant delay. More recently, when the developer began to submit permits to begin the construction of the work, it was found that an easement that belongs to Con Edison needs to be provided. The issue right now is that Con Edison wants essentially a concrete wall that will, or a wall of some type that would separate the alternative fuel station and provide a certain heightened level of security to protect Con Edison infrastructure. That infrastructure that Con Edison is asking that the city or the developer provide is at this moment prohibitively expensive, and we are trying to find out a way that we can either share that cost with Con Edison, or that Con Edison can reduce their level of what they're calling for as part of that project. I'm happy to work with you to communicate to Con Edison that we are eager to move forward. I think we are just as frustrated as you are about this not moving forward. And I can tell you right now that I have a specific time frame where we hope to have resolution.
So within that time that it took the city to move forward, where we're at 10 years from now, and within that time frame, another company has moved into Hunts Point, and they've opened up their own alternative fuel station. You know, and it's just disheartening that we've been working with the city on this one alternative fuel station. When they finally get their act together and they build, they're not going to have the business that they thought they will have, because a private competitor has already moved in to the district. So I guess we'll continue having conversations on that. Very quickly, another project, something else that I'm hearing a lot, I'm actually getting calls, it's not me, it's my neighboring Councilmember Diaz. The New York City Ferry launch, the Soundview route, you know, I know that it was something that the community in that part of the district, or Community Board 9, was advocating for, but I'm hearing a lot of complaints from the Clayson Point residents about parking issues. Why did the city not address the parking? Why wasn't parking part of the plan? Was there ever a site to provide parking for these individuals who are driving there and taking the ferry to the city?
So as part of that process, you know, when we launch ferry service, it is typically in neighborhoods where there is a high concentration of residents. The hope is, and it doesn't always work out this way, but the hope is that most people that take the ferry either go there by foot, go there by public transportation, or go there by bike. In terms of foot traffic, that is an area that has a high concentration of residents at the end of Soundview Avenue in Classen Point Park. In terms of public transportation, we worked very diligently, and with the support of Councilmember Diaz and CB9, we were able to get the MTA to extend the BX27 from where it used to terminate at, I can't recall the name of the street now, but it was about a quarter mile to half a mile from the landing. We were able to get the MTA to extend that bus route into the park so that residents no longer have to get off the bus and then walk to the ferry. In terms of bicycles, DOT is in the process of, first of all, the ferry themselves has a number of bicycle racks that people can use for their own use. And DOT and Parks right now are working towards implementing a number of bike racks that people can leave their bicycles at the landing should they wish to do so. With respect to vehicles, there was a property that was brought to our attention by Assemblymember Crespo. We did approach that property owner. However, that piece of property was about a half a mile from the landing, so it didn't make sense for someone to park their car to then have to walk another half a mile to the landing. When we did approach that owner, there was a significant gap in terms of what that person felt that property was worth and what we felt was an adequate price for us to pay. We're talking about precious city dollars, and we are not in the business of just giving away money to someone who believes that their property is worth more than we believe through different appraisals it's worth. We were not able to reach an agreement, and we did not move forward with purchasing that site for the purpose of parking. Right now, I know that the community at large is looking at different parking solutions. In recent years, parking along the east side of Soundview Avenue was converted from parallel parking to 90-degree parking, which in some cases can expand the capacity for cars to park there. Our hope is that people can use the means of transportation that are available to them, namely in this area, the BX39 and the BX27. We pretty explicitly do not encourage people to drive to the landings. None of our landings are designed in such a way that it is encouraging people to use their vehicles to get there. We encourage people to use bike, walk, and other forms of transportation. So at this moment, we don't have a solution for the parking issues at Class and Point Park.
All right. I know that the Deputy District Manager from 9, she'll probably speak on that later. My last question, Charlie, is the Hunts Point Produce Market. Where are we with their contract negotiations? I know they have 3 years left on this current lease. I have a business that just made a $20 million investment. They are growing, and he's concerned that they may not get to a good space, a good place on this lease, and he may lose that $20 million investment. And just to be clear, you know, the city in their last negotiations in the previous administration wanted them to go half, I believe, on the reconstruction of the market. But the city is the landlord, you know. The city owns the structure, they own the building. So I think that it's inappropriate for the city to ask a tenant to help pay for the structure of the building, yet they have no ownership of the building.
So that is a very complicated dynamic there, and just for the record, you and I have a meeting next Wednesday to discuss this very topic. There are various different ways in which the city manages properties in Hunts Point. Some of them are ground leases to a company, and that company, in essence, what is called a triple net lease. They pay the property taxes, they pay the rent, they pay the insurance. All we do is collect rent from that tenant, and it is that tenant's responsibility to upkeep that building to the standard that is appropriate for a building to continue to operate. A number of our leases in the Hunts Point Food Distribution Center operate in that manner. Baldor Foods, Anheuser-Busch, Citarella, Sultana, Chef's Warehouse, you name it. There are a number of businesses where we do not get involved in the day-to-day operations, nor do we invest in those facilities, because it is the responsibility of those businesses to invest in those properties and to maintain those properties. However, the city does have, given the nature of the businesses, the nature of their operations, the amount of jobs that they supply, the city has a pretty direct interest in how the food markets operate. In this case, the fish market, the meat market, and the produce market. All of these are sort of separate and different from our other leases with businesses where we have a direct relationship with the tenant, which is a business. In this case, we only have a relationship with the cooperative. So the fish market, for argument's sake, may have 27 businesses. The meat market may have over 50 businesses. The produce market has over 100 businesses. We don't have a direct relationship with those 100 businesses. We have a direct relationship with the co-op, who then has a relationship with those businesses. Our relationship to the co-op is we collect rent from those cooperatives And those cooperatives, in essence, manage the facilities. Given the nature of the buildings, the age of the buildings, the conditions of the buildings, the city historically has invested a portion of capital funds to renovate, expand, improve those facilities. Together with the council member who allocates funds as well as the borough president, we all invest in those facilities. However, it is ultimately the responsibility of the tenant, in this case the cooperative, to maintain those buildings. To the degree that they cannot do that, that is a different conversation. We have had in recent months, and I think I've discussed this with various folks in this room, the fish market, when it moved from Fulton Street in Manhattan to the South Bronx in 2005, there was an anticipation that a number of those businesses would move with that cooperative to Hunts Point. The sad reality was that not all those businesses moved, and what that meant was that the building in Hunts Point was overbuilt for the number of businesses that ultimately moved from Fulton Street to Hunts Point. What that means for the cooperative is that they historically have paid a rent above and beyond their capacity to pay because there's empty space that is not producing income because there's not enough businesses to occupy those spaces. The Fulton Fish Market brought that to our attention. What we then did was we segregated a part of their lease, essentially right-sizing their leasehold for the amount of square footage that they occupy. The reason I provide this background is because they were paying rent above and beyond their capacity to pay. It also meant that they were not investing in the building as per their contract. And what we did is we stepped in, we provided additional city capital money to modernize and fix some immediate concerns of the building, for instance, a fire alarm system. And we have now relieved of the fish market their burden of maintaining the facility. So what that means is that they now have the co-op and those businesses are now paying less rent and they can reinvest in that building. We are having similar conversations with the meat market and the fish market, the produce market, about how can we restructure these leases and these relationships so that it better serves them, it better serves the city, and ultimately better serves workers. What you are referring to specifically with the produce market is that they have, their current term of their lease expires in 2021. However, they do have the ability to exercise a 10-year extension option in 2021. So in essence, their contract really runs through 2031. We are in active conversations with them about the future of that asset. Some of you may not know this, but the federal government in recent years implemented what is called cold chain compliance, and what that means is that a piece of fruit or produce has to be at the same temperature constantly, from when it goes from a factory to a truck to the warehouse to when it's at the point of sale to a customer. And what we are having conversations with the market is how do we modernize this building in such a way that allows them to have a modern building, to have safe working conditions for their employees, but also helps them meet the requirement by the federal government to have cold chain compliance constantly. And that is a very expensive project, and we are hoping to begin a conversation with the cooperative about how can we finance that project, and that is what we are looking forward to speaking to you with next Wednesday.
Thank you. My message to your president is speed up the process. These markets, they don't have the space, the capacity that they need to store all of their produce in these refrigerators indoors, and so they are using trailers as refrigerators, who are using diesel fuel at times so that they can keep their produce cool. Therefore, it's not good for the environment. That is why our asthma rates are too high. EDC continues to work on a snail pace, and you're delaying the process. Thank you.
Thank you. Thank you. Mr. Crespo.
Thank you, Madam Deputy, and good morning, Charlie.
Good morning.
My question is, the councilman asked already one of the questions, which was the produce market, but my other two questions is why hasn't EDC come to Community Board 2 in the 10 years to explain about the alternative fueling when they were so adamant at the beginning when it was being proposed. They were on top of us to try and get that approved, and the councilman was the DM at the time, and we were, being pushed to get this approved, and then we never got any feedback. And I know that our present district manager has been asking about this, and we still didn't get no feedback until today. Until today. Why is that?
So we provide updates about the alternative fuel stations every 6 months, typically at the Hunts Point Vision Plan meetings, which the community board is a part of. The most recent one was several weeks ago, where we did provide this update on the alternative fuel stations at the Hunts Point Vision Plan meeting. I think for the purpose of time, not duplicating efforts, we try to some degree, use the Hunts Point Vision Plan as the forum where we provide updates. If there are individual things that you would like us to present on, we can organize for that. But I think, we don't want to have a public meeting, have a community board meeting, have a Hunts Point Vision Plan meeting. So we try to consolidate a number of these updates at the Vision Plan meetings, which typically happen every 6 months.
But there was no vision plan meetings when you needed to get the approval of the board. So now that you got the approval, so forget about the board.
That is not the case, no. Again, we provide updates typically on a 6-month basis on that and other things that are part of that vision plan.
Okay, Charlie. My next question is, why hasn't EDC taken the lead on the rezoning of the Southern Boulevard area instead of letting city planning handle that, where it's affecting Community Board 3 and Community Board 2, and there's a big strip there from 163 all the way to 174th Street with stores, and we don't see anything. You guys should have been taking the lead on that instead of city planning.
I appreciate the compliment, but I can't.
I'm not giving you a compliment.
I can't answer that question. We EDC do not self-decide which rezonings we take or don't take. It was an administrative decision for city planning to take on that rezoning.
All right. I'll have the councilman ask your president then, why is that? Because it's ridiculous, city planning trying to figure out what industry is going to come in through Southern Boulevard, both in Board 3 and in Board 2, and they don't know anything about economic development. and so how could they be taking the lead? Thank you.
Thank you, Mr. Hall.
Oh, yeah, sure.
Just wanted to ask you a technical question. I think you might have answered some of it, but the term lease administrators in managing a portfolio, how does that work? I mean, are you temporary landlord as a city and you manage the profits? How does that process work?
So there's about 3 different ways that the city manages property. There are the Department of Citywide Administrative Services that manages property from different, in different cases it's usually an asset that the city owns that is housed by an agency that operates out of that asset. Is typically managed by the Department of Citywide Administrative Services. There are other agencies that manage their own assets, whether it's FDNY, NYPD, DOT, et cetera. Where EDC comes in is that we are, in essence, providing expertise in managing an industrial asset in most cases. So the city owns the land, but the city does not assign that to either DCAS or some other agency to manage it. So think of us as a property manager on behalf of the city for predominantly industrial assets. In Hunts Point, we manage a number of those assets, but it technically belongs to the city. The Arthur Avenue Market is city-owned land, but we administer that lease. In other parts of the city, for instance, the Brooklyn Cruise Terminal, the Manhattan Cruise Terminal, Brooklyn Army Terminal, those are all land and building that's owned by the City of New York as an entity, and we come in as property managers to administer the lease of those assets.
Is the profit margin also managed by you, or in terms of redirecting that profit and those monies?
So what ends up happening, and I'm not a finance person, so I can't get into the nitty-gritty here, but what typically happens is that the City of New York historically rents these properties at below market rate. And what that does is that it allows for these businesses to grow. And a conversation that we'll have with respect to Hunts Point is that we hope that generates more jobs for local residents and for the city as a whole. We collect the rent. A portion of that we keep as our fee for administering that lease. That money is what pays our salaries at EDC, and then another portion of that goes back into the city general fund. So in essence, looking at it from a 30,000-foot level, EDC is not a tax levy agency. we are self-financed in the way, in essence, the revenues that we collect from managing assets is what allows us to operate, and in many ways allows us to then redirect some of those funds back into the city coffers for other things that the city decides that it wants to do with those funds.
Thank you. I think we'll move on to the next question, which is expense and capital plans to expand service. So as an agency, what is EDC's plans for the borough? And there are several other sub-questions, but I'll just leave it at that.
Yeah, I think the specific question here was with respect to ferry service. I think, as many of you know, there's a conversation going on right now about the expansion of 4 Metro North stops: Co-op City, Hunts Point, Morris Park, and Parkchester. I believe actually this Saturday there's a working session of some sort in Parkchester to talk about that project. EDC is more intimately involved in the Morris Park aspect of that project, given its proximity to a core hospital center with Einstein, Montefiore, and others operating there. And what we're hoping to achieve is looking at how can we enhance that corridor to expand the medical field there. So, where we're working in terms of that is we're working with the city planning, with the borough president's office, DOT, looking at different planning aspects of each of the neighborhoods where those stops are going to come. So I don't have anything right now in terms of what we hope to implement in the coming years. With respect to ferry service, as I mentioned earlier, we launched the Soundview route this summer, and we recently had a conversation with community boards, elected officials in this very building to discuss where could we look for other neighborhoods to potentially expand. And the product of that conversation will be coming out in the next several months, hopefully before the end of the year. And again, that's looking at other areas, not just across the Bronx, but across the city, of where could we expand the service to better serve transit desert neighborhoods. In terms of expense, as I mentioned, we are not a tax levy agency, so we don't typically get involved in expense funding. With respect to capital funding, we have, and I don't have offhand, the amount of backlog money that we are holding on behalf of other agencies to implement projects, but as I mentioned earlier, infrastructure work that's happening here in Lower Concourse, we will be implementing that in the coming years. There's sort of different fiscal years when that money is allocated and available. The work that we will be doing at the Orchard Beach Pavilion is money that is in a future fiscal year, which we will be implementing in the coming years. So we don't have capital money of our own. Essentially, we are capital money dedicated to specific projects flow through us for us to then build things and projects on behalf of other agencies.
Oh, okay, great. Any questions? Can you come to the mic?
I just wanted to say on behalf of CB9 that we are really adamant about parking for the Soundview Ferry, and that we would like to have more conversations offline about what can be done here. We don't believe that extending 2 bus routes is sufficient accessibility, and we want the maximum amount of ridership here. So we just want to welcome to have future conversations and not to take parking off the conversations, off the table.
Okay.
That's all. Thank you.
Happy to do that.
Okay, I guess moving right along, unless there's any other questions. Speaking to expense and capital, and is there any way EDC can help the Bronx obtain something like a Chelsea Market here in Bronx?
So I think that question would require a bit more details, but I think what I'll say is I think we are, as was mentioned earlier, we're going to be working with implementing a nearly $1.6 million project at the Arthur Avenue Market, which we hope to expand their capacity, expand their ability to service residents not just of Belmont, but of the Bronx overall. We have several different ways where we could facilitate something like this happening, maybe on a private site. Whether that's a fresh program that facilitates the sale of fresh foods, or different capital programs where we allow companies and businesses to access funding at lower levels than they would otherwise be able to have access to at the private market. So we'd be happy to talk with anyone about what is their vision for something like this in the Bronx and how can we work together to help facilitate that.
Okay. So we asked you to provide us with a list of in the community boards of EDC-owned properties, and we have that list in front of us. It's not by community board. So is it possible that you can resubmit that list by community board?
Sure.
Wonderful. Is there anything, and we're looking at the list, is there anything that you see that's visible, that is, has been omitted that you'd like to speak to at this time?
No, I think a lot of this is concentrated in the Hunts Point neighborhood in CB2. We do administer the lease in CB3, 4, I believe, of the Bathgate Industrial Park, but that is, we administer the lease, which is then with us and the Port Authority, and then the Port Authority with subsequent businesses. And that is a project that is in a community board district that is not community board 2. And then, as I mentioned, the Arthur Avenue retail market. I cannot walk away here without speaking, at least very briefly, about the Kingsbridge Armory, which I know is important to a lot of folks in this room. I can't say much about it. As you know, there's been several instances of litigation, so I'm somewhat limited in terms of what I can say on the record, but what I can say is that we still support the redevelopment of that asset. We hope to continue to work with that developer to make that project a reality. And as soon as they are able and ready to move forward, we are open arms to engage in a conversation and a transaction that facilitates that development.
Thank you. Are there any questions around that? Ms. Hill?
Yes, it's here on your sheet you have, you're waiting for the developer to get to the financing to advance the project. Are we still stuck at that? Are we still stuck at that particular stage? Have we not moved beyond that yet?
Yes. What I would say is the state, Empire State Development entity facilitated a $138 million lease, permanent loan to that developer to help advance that project. And they would have more to say about the finances. I specifically cannot speak to that.
Okay. To be continued then.
Mm-hmm.
Okay. And that leads us to our last question is to explain any particular features of our budgeting process that the community board should take into account, of your budgeting process that the community board should take into account when formulating their request. So basically, what are your priorities that you think we can be helpful with?
So I think there's two features to this. One of which is, I think, given, as I've mentioned in the list, the number of assets that we manage on behalf of the city, if there is a particular asset that you would like us to continue to invest in or to begin to invest in, that is a conversation we're willing to have. I think an example of that happening quite successfully is the Arthur Avenue Market, where we work together with Councilmember Torres and the Borough President's Office to allocate upwards of $1.2 million for that asset. Again, given your advocacy, we were able to also work with the Mayor's Office to allocate an additional $500,000. So if there are other assets that you would like to see us invest in or continue to invest in, we are open arms to and in some cases need your advocacy to make those presentations either to OMB or others about the need for those things to happen. With respect to other features of our budget process, despite the fact that we are self-funded, a lot of the monies that we do collect, again, part of it goes back into our operations to help us continue to operate without the need for city tax levy. A portion of those funds goes back to the city for the general fund. But there's also a number of programming that we do with that funding to help advance different priorities. As I mentioned earlier, we did a capacity building program for nonprofits. That is something that we ultimately pay for. There are MWBE programs that we provide, trainings that we provide, certifications that we provide and collaborate with SBS. If those are programs that are important to you, which I suspect that they are, let us know about that, and I can personally make the pitch to different departments within EDC to see how can we meet the need in different neighborhoods, collaborating with elected officials, collaborating with different city agencies, whether it's SBS or some other workforce, or if it could be some other program. But if there are areas that you see a need that maybe another city agency could use our lending hand, please approach us and we will try to the extent possible to meet some of those requests.
Do we have any questions, closing questions and comments?
Thank you, Madam Deputy. Charlie, just a question. The lots and garages that are Bronx Parking Development, are those leases and contracts managed by EDC?
I can't tell you off the top of my head. It's a bit convoluted between EDC, DCAS, and Parks Department.
Okay, so I get, because the reason I'm asking the question is that, so there are any number of lots and garages. So if we had specific requests or wanted those to be studied and analyzed for other uses, who would we direct those requests to in the budgeting process? EDC. I think when you look into the ownership, they're under Parks jurisdiction. I think all of the lots, but but clearly they're used for parking and other things, and they've been subleased out now to Bronx Parking Development.
You can send them to us, and we can route it to the appropriate agency.
Okay, thank you.
Did I see any other hands or questions? Okay. Excellent. We want to thank EDC for coming and,
thank you.
And being with us this morning. We understand that our previous meeting just didn't happen, so this actually was a great learning experience. I think people in our viewing public will see a different part of how the community boards work in terms of developing their priorities with their budgets, and I think that's an excellent thing to do in terms of involving everyone in civic engagement. So again, thank you for coming.
Thank you.
And let's give them a little round of applause. Thank you. So with that is the end of our presentations, but I know we had a few people come in after we got started, so I'm gonna ask them, anyone who wants to come up from an agency to be acknowledged, to come up, and if you have any announcements or anything that you want to speak about, as we usually do at the end of the meetings, please also come up and I guess make a line. If we can get a mic for all those folks Miss Carter. Yeah, let's start over. Let's do it over here. That'll probably be easier. So if you have not been yet acknowledged here, or if you have an announcement to make, good morning, then please come to the mic.
Good morning, everyone. For those who may not know me, my name is Jackie Carter, Assistant Director of Government and Community Relations. First of all, I wanted to thank each and every one of you who either came to our workshops, participated in our workshops, sent folks to our workshops. I just want to tell you that even though I don't have the actual numbers of how many people have actually attended the workshops, I want you to know that New York City Transit, Jackie Carter, appreciate everything that you did. But the excitement must continue. So what I did bring to you today are those who were there saw these white cards. And what these white cards are connected to our bus survey. We must still continue to have every person in the Bronx participate in the survey, because this is the way we're going to get the rest of the information that we need. I'm going to leave these cards over at the table. I need for you to email blast these out, have little survey parties if you need to at your community boards, but we need to get this information out, because this is the information that the Bronx residents give us that's going to determine how we can reinvent the bus routes. This is a one-year project, as we originally told you, and we need this information. I will leave these cards over by the desk. Please pick them up, blast them out, have conversations. Let's still continue to get excited. The second information, I know I sent all of this to the elected officials and the community boards. Our New York City Transit President Andy Byford is coming to the Bronx. He will be at Holstos Community College on November the 7th. Come on out. He's here to conversate with us. He's been to other boroughs already. He's coming to the Bronx. All of you have received this. I will also leave this information by the desk. Please blast it out. I'll be there. I'll be looking for each one of you. Thank you so much.
Thank you. Oh, there's some questions, Jackie. Yes.
Thanks. Just a quick question on the survey. Is there a deadline for that or end date in mind?
Yes, survey is still up at least for the end of this year.
Anyone else who wants to make an announcement? Oh, wow. I don't know who started.
He's yielding. I just want to quickly announce that on Friday, November 2nd, councilmen, along with Bronx Community College and the Dominican Institute of City University, will be unveiling the first monument to the 300 Dominicans who fought during World War II, heroically fought during World War II, and in many cases were denied benefits because they were not citizens, but it's the first memorial recognizing their service in the country, actually. So we want to extend an invitation to everyone to join us on the 2nd. We think it's a great event. I had a chance to peek at the memorial. It's a beautiful memorial, and it is a long overdue recognition of those heroic folks who fought on behalf of our country during World War II.
Can you give the date, time, and location?
Yeah, I'm sorry. It's November 2nd at Bronx Community College, and the ceremony will begin at 10 o'clock in the morning.
Excellent. Thank you. Mr. Belford.
In the same spirit of honoring our veterans, Councilmember King will be honoring veterans next week, Friday, November 2nd at 11 a.m. at 135 Einstein Loop in the Einstein Auditorium, where we'll be honoring a number of community veterans. And Councilmember would like to thank all of those that came out Sunday to Orchard Beach and marched in support and raised money for breast cancer awareness. Unfortunately, a number of our men are getting breast cancer and are not going to get checked, so Councilmember is asking everyone, man, woman, boy, girl, child, and senior, to get checked. Breast cancer and cancer affects everyone, and we should all get checked. Thank you.
Wonderful. That's a great reminder. A lot of times, men are not looking for those signs, so thank you.
Good morning. I just wanted to introduce myself. My name is Stacy Strong. I am the new district director for Councilmember Gibson.
Wonderful. Welcome. Welcome. Yes, Chair.
Just wanted to state that we have this Saturday coming is our 27th annual Halloween Day Parade. I'm being told that it's the second largest parade in the city of New York. We were supposed to have 10 bands, but 3 of them have canceled due to the rainstorm that's coming down. But thank the PAL, they're letting us use their space so that the children will still have their Halloween festivities at the PAL on Longwood Avenue. And it's starts at 1, check-in's at 12, and it should be finished by 3 or 4 o'clock, right around there. But the parade is still going on with the other 7, so if you want to still come out and march in the rain, you're welcome.
Thank you. Any other folks?
Good morning, everyone. Brian Farganoli from New York City Emergency Management. I just wanted to give a brief update from Emergency Management. The Intergovernmental Affairs team has created a elected official and community board guide to emergency management. Our goal in this is kind of to briefly explain what we do and how we can help serve your constituencies. We've blasted this out via email through our listserv, but if you'd like a physical copy of it, you can reach out to the Intergov team, and we're happy to mail you one. I also wanted to make mention of our community preparedness program. The community preparedness program is looking to help local organizations build capacity within their community to prepare for, respond to, and recover from an emergency. So our goal is to go out to local communities such as houses of worship or civic associations or other groups of people and get them prepared as a community and make the community itself more resilient. And I just want to mention that October is Fire Prevention Month, so we're out with the FDMY doing a number of preparedness events and making sure people are prepared, for fires in their homes. And as always, please reach out to intergov at oem.nyc.gov with any questions or concerns. We're always happy to answer at any point in the day. And I'm happy to take questions if there are any.
With your emergency preparedness, do you also cover high-rise buildings?
Sure, if you have a tenants association or something like that, we're happy to come out and we'll do presentations anywhere, but if you have a community involved, get in touch with us. We'll put you in touch with our community preparedness folks, and we can work out the details on how to best do a presentation for that community.
Any other comments, questions?
Thank you.
Thank you. Any other announcements? Wonderful. So I get to say that the 40th Precinct Community Council and the Bronx Borough President's Office invites you to the Halloween Safe Streets and Treats, the Bronx Pumpkin Fest. You gotta get it, it's a lot. Halloween Haunted House Spooktacular. Wednesday, October 31st. So this is going to be a great event. Obviously, it's an opportunity for safe trick-or-treating for our young people. It starts at 3 p.m. to 7:30, and it will be at the 40th Precinct on Alexander Avenue between 138th and 139th. So we're excited about that. We want to thank all of our sponsors who made that possible, and we hope that everyone will come out and bring the little ones in their various spooky costumes. Seeing no hands or comments, I want to thank everyone again for coming today. I think we got a lot of information. I think we were able to conduct a lot of good business. So have a great day. Go out and make the world wonderful.